Good evening and welcome to the Bournemouth, Christchurch and Paul's Overview and Scrutiny Board this evening. It is Monday the 16th of November at 6 p.m. and my name is Councillor Steve Bartlett and I'm the Chair of the Overview and Scrutiny Board. Before we go ahead with the agenda, could I just ask our Democratic Services Officer to read out a couple of notes on housekeeping for this evening's meeting. Thank you, Claire.
Thank you, Chairman. Please note that this meeting of the Overview and Scrutiny Board is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. In order to ensure the meeting is managed effectively, please could everyone present follow these ground rules for speaking. Only speak when invited to do so by the Chairman. Always turn on your video function when invited to speak. Please state your name before you speak if you have not been introduced by name. Please mute your microphones when you are not talking. If you would like to speak on an item, please do so by utilising the raise your hand function in the bar at the top of the Teams window. The messaging bar should not be used unless you are raising a point of order or providing the wording for a motion. Please remember that this panel is visible to all and subject to public information requests. If at any point you would like to speak again, please use the raise your hand function. If required, the Chairman will ask the Democratic Services Officer if a vote is required, the Chairman will ask the Democratic Services Officer, who will call out each board member's name in turn to take a recorded vote. Thank you.
Thank you, Claire. Agenda item 1 is apologies. I have received apologies from Councillors Farr and Councillors Hall. I understand that Councillor Davies is intending to join us, but we're having difficulty getting him online. So it's possible he may join us at some point. Agenda item 2, substitute members. I'm not aware of any substitute members. Claire, are you?
I've not been notified of any, Chairman.
Okay, thank you. Declarations of interest. Do any councillors have any disclosable pecuniary interest or any local interest on any agenda items on the agenda? I'm not receiving any responses, so we'll take that as a no. Public issues. Claire, are you aware of any public issues that have been raised? I'm not.
No, we haven't been notified of any for this meeting, Chairman.
Thank you very much. Agenda item 5, the action sheet. The minutes from our last meeting have not yet been published, but I am aware that the actions that arose from our last meeting were acted upon by the Cabinet in their meeting, which I think was the 11th. Sorry, I can't remember the date, but there were 2 items that were acted on. There were recommendations regarding the housing allocations policy, and whilst the wording wasn't exactly as we proposed, they were the principles of what we asked were accepted by the Cabinet, and changes were made to the policy accordingly. That was the only 2 recommendations that we made to Cabinet at that point. So I think we can now move on to agenda item 6, which is the main item of business of this evening's meeting. And this is the update on the BCP Council's response to the COVID-19 epidemic. Now, we're very privileged this evening to have a number of people that will be involved, and the presentation and session will be led by Councillor Nicola Green, who is our portfolio holder for COVID resilience. And in a minute, I'll ask her to give us her presentation. But this evening, accompanying her, we do have Sam Crowell, who's the Director of Public Health, and we are very, very appreciative of your attendance this evening, Sam, because I know how busy you are with the current situation. So thank you most sincerely for spending the time to be with us this evening. We also have Councillor Maya Haynes, who is the portfolio holder for safety, and I'm sure we'll be hearing from her as well. Additionally, we have the Councillor Drew Meller, leader of the council, and also the portfolio holder for our economics, and also Graham Farrant, leader of the, Chief Executive of the Council. You're both very busy people. I'm very pleased that you've been able to spend some time with us this evening, so thank you. So I will now invite Councillor Nicola Green if she would like to lead in. I know she will give a little overview of the things that she's going to be covering to start with, and she will then call in the other attendees as required during the debate. But I will monitor the hands up situation, and I'll control the hand up those requests to speak when we get to that point. So I think we can proceed now. Thank you, Councillor Green. Look forward to hearing your presentation. Thank you.
Thank you, Chairman, and good evening, members. I just wanted to add a few words of introduction before we go over to Sam Crowe. A year ago, nobody would have had the title in their portfolio that I have now. We've come an immense distance through an experience that none of us would have wished for. And I wanted really, as the first thing that I say, to acknowledge the contribution and the hard work of the previous portfolio holders in standing up some of the services which I will be referring to. It's been a learning on the job experience for everybody, but for the members and for the councillors alike, focusing on serving our population in these wholly unprecedented times. Tonight's also quite unusual in the speed at which this presentation is coming before you. We would normally have a longer lead-in time, but because of the conflation of dates with the change of administration, I think this opportunity, if I heard the discussion correct a couple of weeks ago, was, well, we've got an opportunity, we've got a date in the diary, so let's get on with it. And I'm very glad for the invitation to come along and get on with it. It was a very broad invitation to give an invitation, so to give a presentation. So I spoke with the chairman to try and cover off what it is that we really need to talk about tonight, and that might be of interest to you as members. And inevitably that may mean that I've missed things, for which I apologise, but please see this as the start of a dialogue rather than anything else, and I would be very happy to take either work away to respond in a written fashion or to come back to you in the future. I note that the Vice Chair of the Health and Adult Social Care panel and the Chair of the Children's Overview and Scrutiny panel are both here, and I'm very pleased that they have come along, but they will now be meeting, they have meetings on the 30th of November and the 1st of December respectively, I believe, so that's another busy week for me, and I should be very pleased to discuss with their panel, if they would like me to, any of the deeper impacts of the COVID pandemic. So in terms of what we're discussing tonight, we've really not prepared very much for them in those areas, because clearly the scrutiny of it sits quite correctly with them. And yet you can't talk about COVID without talking about some of the impact perhaps in care homes and on schools. So it would have been quite improper to exclude it completely. But please members feel assured that there is the opportunity for those areas to have greater scrutiny as we go forward. So just to feed into you, members, what we were proposing to look at tonight was first, not least because of the work rate of the public health team, as Councillor Bartlett has referred to, for Sam Crowe to give his update, and clearly I will be able to take any questions that perhaps won't sit with Sam. Then Councillor Haynes is happy to give a brief update on compliance and enforcement and the Council's response then. And I will follow on with the community resilience questions and comments about volunteering, food resilience. And again, Councillor Haynes will be able to give any responses on financial support. Then we thought just a brief word about what's different about the lockdown that we're in, which isn't the same as the lockdown that we were in. And a few notes perhaps about the economic recovery plan and how our businesses will be looking to move on. A brief note again on communications, and then to follow off with what we're doing to plan ahead for the release of the current lockdown rules, should everything proceed as we expect on the 2nd of December. So with your permission then, Chairman, if we could perhaps invite Mr. Crowe to give his presentation, then he and I will be very happy to answer the panel's questions.
Yes, thank you, Nicola, and thank you, Mr. Crowe, for attending. Please go ahead.
Thank you very much. Good evening, members. If you bear with me a second, I'll just share my screen and then I'll take you through the presentation. So what I've prepared for you tonight is a summary of COVID-19. I've also included some data on Dorset Council, given the interdependency between our two areas. This data is up to the 12th of November, which is the most recent time period, and it's taken from the alerts that I receive as Director of Public Health, which cover the councils across the Southwest. What we look at is the 7-day case rate for COVID expressed per 100,000 population. So I'm going to give you the figures now for BCP Council, currently at 241 cases per 100,000 population. And that was for the period, the 7 days from the 6th to the 12th of November. In comparison, Dorset is currently at 109 cases per 100,000 population. The Southwest as a whole is at 188 cases per 100,000, and England is currently at 269 cases per 100,000. So those measures are really the best way of assessing the current infection rates by area, adjusted for population size. Just a couple of additional notes on the slide there. Testing positivity in Pillar 2, which is the community testing, is currently nearly 9% in BCP Council, which is the highest it's been since we've been looking at those figures. More reassuringly, we are testing many, many more people through Pillar 2. So members may be aware that there were issues with laboratory capacity a few weeks ago, which was limiting access to timely testing. That situation's certainly improved, and we're now testing well over 9,000 people every week in BCP Council and around 5,000 people in Dorset Council. So in terms of the number of cases, that translates to around 950 cases in the past 7 days. Dorset Council around 415 cases in that 7-day period. The age profile in terms of our infection rate is still predominantly affecting younger age groups, but the infection rates are continuing to rise in the over 60s. I'm going to show you a heat map shortly, which shows that a little bit more clearly. And that's a metric of concern, and we do monitor the infection rate in the over 60s very carefully, because it's very closely correlated with the impact on our hospital system locally. So as that rises, we see a corresponding increase in hospital admissions. So it's important that we continue to monitor that very, very closely. Currently, it's at 145 per 100,000, according to the alert that I receive. That's expressed as the rate among the over 60s. Just a little bit more context around transmission of COVID. We're still seeing transmission within households as the single most important exposure, being cited on contact tracing, followed by reports of people having contracted COVID through socialising and visiting friends and family. So it's important to note that the cases that we're seeing now are still largely infections that occurred before lockdown began on the 5th of November. In the past 7 days, I was also going to give you an impression of the amount of work coming through the public health team. So across both councils, we've seen 83 new notifications of COVID situations, and that's across a range of settings. So just to give you a flavour, that's 30 schools, 26 care homes, 12 early years settings and 3 healthcare settings, and 9 workplaces spread across both councils. I'm afraid I don't have a breakdown in this presentation about the exact split for BCP Council, but I can provide a post-briefing note if that would be helpful. And at the current situation, we have 138 people in hospital with COVID-19, and obviously we're continuing to do all we can to prevent further infection because of the pressure that that induces on our hospital systems. The acute hospitals are currently all declaring that they're in major incident standby mode because of the pressure in their wards. Dorset Healthcare is currently at business continuity level 4, so not yet at that major incident standby. Just a couple of notes on transmission. It's too early to see whether the current national measures are having an impact. We won't really see that in the data until the week beginning of the 16th of November. So I'd expect the next 2 to 3 days we'll be looking for any evidence of a slowdown in our recent rise. There is some evidence that we've seen an upturn in cases, not only locally, but nationally, linked with the days just before lockdown. The mobility data that we get from Google encouragingly shows some drops in the time that people are spending connected with retail, grocery and pharmacy settings, and also what Google call transit stations, which we take to be motorway service stations. But there's no change in the traffic to and from workplaces, interestingly enough. We continue to see outbreaks in high-risk settings, as I've shown previously. Care homes, schools and early years are the most important of those currently, but they are being managed well. And one of the things that I'd like to give assurance to this board tonight is that the support being given to those settings is much more routine in nature. Frontline staff, public health staff, council colleagues and CCG colleagues are all becoming much more used to the infection prevention and control advice and guidance being given. And currently we're assured that they're being managed as well as they can be. Current communications messaging under the local outbreak management plan has moved to our red strapline. So we're emphasising the stay at home messaging and stay safe outside in line with national guidance. So I just thought I'd show you this heat map, which shows you how the infection rate is changing between age groups over the past 3 weeks or so. And what you can see here on the screen is the very high infection rate, which started in the 16 to 29-year-olds. You can see how that's changed over the past few weeks. It started to come down through October, but has been rising again in the early part of November. One of the issues that these heat maps show is the spread of infection into other age groups. So you can see that it started to pick up in the 30 to 44 age group, but more worryingly spreading into the 45 to 64-year-old age group and into the 65 plus age group. So this is a map that we pay quite close attention to, just to try to see what is happening in the population in terms of the pattern of transmission. And although our current infection rate in the over 60s for BCP Council is relatively high at 145 cases per 100,000, there may be some evidence in the over 65s that the infection rates may be starting to slow or even drop off. So they were at around about 150 a week ago or so. It looks as if they're starting to come down, but we'll obviously monitor that very carefully over the next few days. Just a few notes on testing. As I mentioned in the opening slide, more than 9,000 people now a week being tested regularly through Pillar 2. I've talked about the positivity rate increasing. We've been successful in bringing forward additional local testing sites, which provide access to people who can't drive to the Creekmore regional testing site. They have now been halted by the Department of Health and Social Care. We can't bring forward any more new local testing sites, but we are able to bring forward additional mobile testing units. So 2 successful additional MTUs are going to come on stream next week. For BCP Council, there'll be a site at Hawkswood Road Car Park in Boscombe, and in Dorset Council, there'll be a site at the Norden Park and Ride in Wareham. More interestingly, you'll have picked up from the media briefings the use of these rapid antigen tests, which are coming on stream quickly. So these are the tests that are being used in the mass testing up in Liverpool. We have signed up to become a pilot site for BCP Council and also Dorset Council to use these rapid antigen tests to support safe visiting around care homes. And the Health Protection Board agreed a paper today to look at the first round of pilot uses of those devices. So not only supporting safe visiting in care home, but the testing of professionals going into care homes, which we think is really, really important, and also to do some testing around homelessness shelters as the first use cases, if you like, of those rapid tests. If they can be used safely and effectively, and as we get more experience with them, we would look to extend those to other settings. We're very interested in looking to see whether we could use those devices in domiciliary care settings, just to continue to do all that we can to protect the vulnerable. And the routine testing of NHS staff begins next week using the same rapid devices. So the council isn't responsible for delivering that service, but they are using those rapid antigen tests in the NHS beginning next week. So a couple of notes on vaccine development. The mass vaccination planning locally is being led by the NHS and not councils. It's anticipated that the first cohort to be vaccinated will be the over 80s. There's a local group established to look at the planning around the mass vaccination of the cohorts. Both councils are involved in that group. They're looking at the strategy, the planning and the communications in readiness for the first two cohorts to be immunised. There are several vaccines that are returning encouraging results. So the government has invested in at least 3 of those vaccines, which are due to come on stream, hopefully fairly soon. It's important to note that until the safety data is published fully, it's unlikely that the legislation will be changed to enable the vaccines to be deployed quickly. So there's a sort of sequencing that needs to happen with the full publication of that safety data, and then the legislation laid to enable the vaccines to be added to the national schedules, and then the vaccination programme can kick in at pace. But the plans are being developed in readiness so that that can be speeded up as much as possible. Locally, they're looking at a lead provider model to work closely with primary care networks to make sure that the first cohorts can be identified and supported to be vaccinated as quickly as possible. One of the roles that the Health Protection Board and partners will play is supporting the communications and engagement work. It's really important that we make sure that residents are understanding of the vaccines that are coming on stream, understand the benefits very, very clearly, and that we can support the rollout as effectively as possible. What we want is to ensure a really good coverage of the vaccine when it comes, and not make sure that there's incomplete take-up. Just a slide for what might be the state of play post-lockdown. So if we do see cases come down and the national plan is to lift the lockdown on the 2nd of December, it's really important that we have a good understanding of exactly what restrictions may apply locally when we come out of the national measures. So the plan at the moment is to try to stay within the former Tier 1 restrictions as much as possible. But we're well aware that if our case rate remains relatively high in BCP Council, there'll be an expectation that we will have a very clear plan to continue to try to reduce incidence. So working with the Local Outbreak Engagement Board, we'll continue to meet regularly to review the position and develop clear messaging to the communities to make sure that we are well stood up if and when those national measures are lifted. The plan that we would want to bring forward to contain the virus if and when we come out of lockdown will be known as our Contain and Enable strategy. It's likely to focus quite heavily on the deployment of those rapid tests, enhanced communications and engagement in key communities underpinned by better behavioural insights work to really target those messages. We've been doing a lot of push communications from the centre and supported by both councils throughout the pandemic. And I think some of the evidence that we're picking up at the moment is that that continued push can sometimes fall on deaf ears. It's been a lot of very, very centralised messaging. Really important now that we start to work with our key groups with perhaps more intelligently targeted comms and engagement work to really drive home those messages in a way that will resonate with those communities. The final part is enhanced contact tracing. So there's been a lot of talk nationally about local authorities picking up additional contact tracing. We're already standing up welfare calls and making regular calls to everyone who tests positive for COVID-19 across both councils. What we need to now look at is additional support to enhance the national test and trace offer. So that could be following up on non-responders, or it could even be potentially putting local contact tracing into place should there be a need connected with a local outbreak, for example. But the critical bit for us will be the availability of local resources. So you'll be well aware that during the lockdown, both councils have been making additional calls to the clinically extremely vulnerable. That's an awful lot of calls going out through customer services, and the impact on those teams is huge. So we need to be very mindful of how best to use that scarce resource where it's going to deliver best value and have the greatest public health impact. So that's something that I'll be thinking about as we develop that plan this week. We're also working at a regional level, working with other councils and other directors of public health to look at what would be delivered potentially regionally under the plan and what would be delivered locally. So there's additional funding coming to councils of around £8 per head to support bringing on stream those additional measures. And the planning's beginning apace to make sure that we've got clear plans as to how we use that resource effectively. The final point here is obviously as we come out of lockdown, there'll be a continual need to balance those public health measures with the need to keep the economy going safely. So that'll be a key strand in any comms and engagement that we're doing after the 2nd of December. So those were my slides for tonight. Hopefully that's given members a bit of context around the current situation. Happy to pause there for any questions and to hand back to Councillor Green.
I think this is where we hand back to the chairman of the meeting to manage it for the next section, and then when you're ready to press go on the next bit, I'll happily move that on.
I can't see anybody's hand up at the moment. Here we go. Councillor Slade.
Thank you, Chair. I wasn't sure sort of whether we're taking this in slices. So I've got 3 questions, but I'm going to limit it to my one around the medical side, assuming that we're coming on to the other bits later. I know of 4 people, 2 of whom have died, who have acquired COVID in Poole Hospital. And that is an absolute tragedy. One only went in for a fall, and I know that a lot of the wards have been closed and visiting has been stopped, etc. What assurance can we give our residents that it's now safe if they have to go into Poole Hospital, that they've got, you know, minimal risk of acquiring something which they wouldn't get if they were at home?
Thank you, Councillor Slade. So I've been off for a week, but I believe the situation before I went on leave was that the outbreaks were under control. Poole Hospital and Royal Bournemouth both had several wards that were affected, but they've been working very closely with Public Health England to make sure that the right measures are in place. I haven't heard through the Health Protection Board today that there's an ongoing concern. So my current assessment is that those outbreaks are being controlled. The adequate testing, follow-up and contact tracing has been completed, but I'm happy to take that away and come back to you with further information if that would be helpful.
Thank you. I think it'll just be reassuring to residents. Thanks.
Councillor Slade, could I just bring in, I know other people have got their hands up, but I know that Councillor Nicola Green has put her hand up, and I suspect that she wants to add to that possibly. Is that correct, Councillor Green?
That's right, and Councillor Slade is absolutely right to ask the question and to impress the seriousness of it. And I can give no more an answer today than Sam has given. But the NHS are expected at the Health and Adult Social Care Overview and Scrutiny Board on the 30th of November, I believe, and I would expect those questions to be very much at the front of any questioning that goes on. So I would suggest perhaps you might want to put that date in your diary, but clearly any further updates we can have in the meantime, I'm sure will be of vital interest to all members. Thank you, Chairman, for letting me come in.
Yeah, thank you, Councillor Green. You've got 2 more questions, Councillor Slade. Do you want to ask them now?
One relates to children, so it probably is quite appropriate for Councillor Green. The other one relates to finance, so that might be best for Councillor Mellor. So, yep. Councillor Green, I'm aware of an MP elsewhere in the country who raised a concern about a school in her area that only got 12 laptops. The children had to self-isolate, 100 children off, only 12 laptops for 100 kids that were on free school meals. Have we checked with all of our schools that where there are closed schools or groups, bubbles that are closed, that every child entitled to a laptop has been given the provision of a temporary laptop?
Thank you, Chairman. If I may, in terms of every school, no, we haven't. I don't believe, but I will certainly get back to you with the updated figures on that. So this is in terms of children self-isolating. The children where children are having to self-isolate and where there was a need because they were free school meals children. I want some assurance that those children have got access to that education. Thank you. Yes, I don't have that with me, but I will certainly come back to you. Thank you.
Thank you very much, Councillor Green. Okay, we'll come back to your finance question later, Councillor Slade. Councillor O'Neill.
Thank you, Chairman. There was Sam Crow made a number of comments about how post-lockdown, we're all hoping there is a post-lockdown, that would be managed. Could some comment also be given by either of the presenting parties on how care homes are going to be supported and managed over the same period?
Shall I start, Chair?
Yes, please.
So the current situation is that the Health Protection Board, which meets weekly, assesses the current risk in the community from looking at our understanding of infection rates. We then use that discussion to brief the rest of the system, and a regular letter goes out to care homes on a weekly basis with our advice from the Health Protection Board, as opposed to our current assessment as to whether it's safe to continue visiting. Locally, we'd like to do everything we can to continue the arrangements to enable people to visit their loved ones in care homes, and that's why I mentioned the importance of these rapid tests that we're starting to get through from the Department of Health and Social Care. If we can use those to support safe visiting in care homes and to enable that to continue within the guidance, that's something that we would very much like to see continue. I think it would be an extreme measure to stop visiting to care homes, and the public health evidence of the assessment of the impact of that on local infection rates is minimal compared with some of the impact of what we've seen through the national lockdown, for example. So my assessment and my advice is we need to do everything that we can do as a system to try to continue to support safe visiting in line with the guidance.
Thank you, Sam. Nicola, did you want to come in on that as well?
I think the only thing that I'd add is that, as I mentioned earlier, those who were involved in this earlier in the year would have spent a great deal of time on the very real concern of the lack of PPE. That is not currently an issue. I don't know if Sam's got anything to add to that, but that very real, very pressing challenge which faced the country and all sectors working with people who were COVID positive early in the year is something that I think we can reflect that there has been, and I take no credit for this. This is a national picture, but it has made a big difference to the safe practice around working with people in that field.
Thank you, Councillor Green. Councillor O'Neill, are you done?
Yeah, thank you for that. Thank you, Chair.
Okay, thank you. Councillor Kelsey.
Yeah, thanks, Chairman. It's a couple of questions, really. Sam, we keep hearing about all the numbers of the people that are contracting it and that are going into hospital, etc. A couple of points. What is the average length of time that people are actually staying in hospital, if there is one? And on their release, how are we coping with where they go on their release? Are they going back home? Are they going into respite care and things like that? We don't seem to hear about how many people are actually recovering. We just hear about how many have it, and it's quite annoying that, you know, you get 300 one day, 300 the next day, but nobody ever says, well, actually 430 came out having recovered from it.
Thanks, Councillor Kelsey. I think it's a really good point. It's not straightforward, so perhaps I could take that away from the meeting and provide a briefing note. One of the live discussions that's happening this week is about discharge from hospitals to improve flow. So there's work going on to make sure that the policy around when people are considered safe to be discharged into different settings is being reviewed this week. So if the chair would accept that, would I be able to provide a briefing note to the board? Because I don't have the data to hand about length of stay, for example.
That'd be fine. Thank you, Sam. Are you all right with that, Councillor Kelsey?
Yeah, more than fine, Chairman. Thank you. That'd be really helpful. Thank you.
Thank you. Councillor Millie Earle, please.
Thank you, Chair. I had a question really around sort of the secondary impacts of lockdown and how that's affecting people this time round, because it's a bit different to last time. You know, we're in winter, it's getting dark very early in the evenings, and anecdotally from a lot of residents I've heard about how people are finding it particularly hard this time round because they're not able to go to any social settings, obviously, but a lot of them, particularly sort of our elderly and more vulnerable groups, are really feeling much more of a mental well-being impact on them. So I just wanted to ask, from a public health perspective, has there been any looking into the facts and the figures and the evidence around how lockdown is impacting people who are maybe already very lonely, and now that any sort of outreach has been taken away, and whether that's having an impact as a secondary health effect?
Thanks, Councillor Earle. It's a really good question. I think, to be honest, in terms of the public health data that we can access, it's far too early to say. I think it would be a good question to pose to some of the services that perhaps support people on a more immediate basis. One of the public health measures that I did look into was the impact of the first lockdown on suicides nationally. The national assessment was that there hadn't been an increase in suicide connected with the first lockdown, but as you've made the point, the situation is very, very different with a different time of the year and perhaps people not being able to get out as much as they were before. So I think it's something that as a public health team, we do understand the need to balance the responsive public health measures because of stopping the transmission of COVID against the kind of longer term impacts that some of these measures have undoubtedly on some sections of the community. I think that's why we feel so strongly that if we can support safe visiting, for example, so that relatives can see their loved ones in care homes, we need to continue to do all that we can. One of the measures that was interesting about this lockdown was the guidance enabling the continuation of support groups, and I think that's really important. So, vulnerable people who are used to receiving that group-based support can continue to do so in groups of up to 15. I think there's increasingly a recognition that we need to do all that we can to try to keep those connections going as fully as possible, just recognising the importance of that social contact. But I think it's too early for us to say as a public health team whether we're seeing that impact yet.
Thank you. Okay, is that all right with you, Millie?
Yes, that's fine. Thank you for that. And I do think you're right. It is quite early to know if that's going to have a lasting impact, but hopefully in the immediate, people are getting the support that they need.
Thank you. Councillor Richard Burton, please.
Yeah, hello, thank you, Chair. Mine's a slightly technical question, so it's probably for you, Sam. It's about the rapid testing. I was just wondering if you, as a person, get infected with a, shall we say, reasonably low viral load, how long before the rapid testing actually will give you a positive result? Being as it's one of these things that we're relying on now as one of our front line of defence, and are you capable of infecting somebody before that test will be positive?
Yeah, it's quite a technical question. So until we've had experience of using the devices locally, I think it's hard to judge, but they definitely work best when you've got a high viral load. So if you've got lots of virus circulating, you'll get a better signal from these devices and you're much more likely to show up with a very clear result. They were originally designed for widespread testing of asymptomatic people. We need to really see what the experience of their use in Liverpool shows in terms of their sensitivity and their specificity. So that's the ability of the test to truly predict whether you're a true positive or whether you truly don't have disease. And I think it's fair to say that that evidence is still accumulating. I've seen a couple of papers in the past day which suggests that the sensitivity is pretty good and the specificity is actually quite high. So they are more likely to give a false positive result than a false negative. So in terms of the likelihood of people being in the community having had a false negative, that is very much less likely than having a false positive. So they're kind of weighted on the side of caution, if that makes sense.
Councillor Burton, are you okay?
Yes, thank you very much. That's very helpful.
Yeah, thank you. Councillor George Farquhar.
Thank you very much, Chair. My question also relates to the rapid test, the antigen. You mentioned that you was looking at the homeless shelters. I wonder if Sam could sort of expand on that, particularly in relation to the homeless partnership, which we enjoy here in the conurbation, and the outreach teams and the mechanics of how that will actually be rolled out, because I think those living on the streets are amongst our very most vulnerable, and I've very kindly received information from the leader of the council as regards the availability for places for them to self-isolate, but I don't understand the exact mechanism whereby we identify those that are homeless or rough sleeping in getting these tests so that we can actually provide the facilities to them to self-isolate.
Thank you. I think it's early days, to be honest, Councillor Farquhar. So this afternoon, the Health Protection Board sort of approved the concept, if you like, of using these tests in a number of settings and locations. The next round of discussions will be to work alongside services and service users to understand how best to deploy them, because there are a number of pragmatic issues that need to be overcome. There's quite a detailed standard operating procedure about how the tests are used. It's really important that people are supported to understand the test result, and you obviously need to work through the consequences of a positive test, as you've alluded to in your question. So that would be the sort of next round of discussions to make sure that we've got an end-to-end process that's well understood.
Councillor Farquhar.
If I may, Chair, could you give us an idea of the time frame for the next round of discussions, if you please, Sam?
Because we've only just decided this literally today, I imagine the testing cell will be starting to make contact with services over the next week. We still need to be given a date when we will receive our first deployment of rapid tests, but perhaps I can come back with a note to the board when we have more detail.
Happy with that, Councillor Farquhar?
Absolutely. Thanks, Chair, and thanks, Sam.
Thank you. Councillor Cox.
Thank you, Mr. Chair. I'm really, it's a question about the so-called COVID officers that have been put on the streets, apparently. I just really wanted to know, what exactly were they doing, or what are they supposed to be doing? Who do they report to, and what assessment is made of them as to how effective they are and what they're supposed to be doing?
Councillor Cox, I think we're going to be coming to that shortly in the next phase of the presentation. So I think your question is logged, and I think we'll be coming back to it shortly, if that's all right.
Yeah, no problem.
Thank you. I think that's probably all. Addressed all the questions to you, Sam. I don't have any more hands showing. So thank you so much for that very useful presentation. Councillor Green.
Thank you, Chairman. I've recorded my thanks to Sam and the Public Health team at the Joint Public Health Board that we held about 10 days ago. But I would like to say so in front of the Overview and Scrutiny Board. It's not the first time that Sam's come before the board, but as it's presently constituted, it is, and the team have been working incredibly, not only long hours, but in an extraordinary set of circumstances, and providing very, very up to the minute detailed information, responding to members' inquiries, and really providing the basis on which all the communications that have gone out to the public to provide that reassurance have been based. Thank you, Sam, for your time and the support that you provide to members and officers throughout. If I could then, if you're happy, Chairman, for me to move on, I thought it might just be worth a very brief update about what's different about this stage of the lockdown, and therefore how the council's response is slightly different. So while some of the services were mandated as needing to be stood down, the administration's presumption really was that others should remain open. So we had to close our leisure centres and our libraries, but our parks, our gardens and our beaches remain open. And we further enabled that by our choice to keep car parks open, toilets wherever possible, and some takeaway concessions, really to make those, on those days when we can get outside, given the weather's a bit hit and miss, to make it attractive for members, for residents to get out and enjoy the nice things that we still can do and do safely. We've maintained, and of course this was a big issue earlier in the year, the household waste and recycling centres, and there's been no change to our bin collections. Schools have remained fully opened, notwithstanding that some have had to close to year groups or particular cohorts following the need to self-isolate. This is clear national guidance and we followed it. The universities have remained open as well. We know that there is more teaching online, but they have, as we're all aware, we've had a reasonable cohort of students back in town. We've also continued detached youth work for small youth groups. Some virtual groups have continued to meet. I think I was glad that Sam mentioned in response to Councillor Earle's question that support groups of up to 15 people can continue to meet. And I think that's been absolutely crucial in recognising the impact that isolation can have on people's mental health. The youth group have continued to work with small support groups, particularly for vulnerable children, where possible. A concern for all members, I think, during the first lockdown, and it remains a concern clearly, but the domestic violence outreach groups are continuing to work, and the Community Safety Partnership is meeting monthly. It formally meets quarterly, but in recognition of ongoing pressures on our wider communities, that's been stood up. Obviously, the hospitals are currently continuing their elective work, and the wider aspects of the health service have still remained open, in contrast to earlier in the year. But members, if they want to go into more detail, I'm sure we'll have the opportunity in the Health Overview and Scrutiny panel. There is clearly some difference in retail and what's been able to stay open and what hasn't. And just to pick up as well on Councillor Farquhar's question, I'm very glad he answered it, and indeed this may be something that in future your panel may wish to do a deeper dive into, is the homelessness services. So we're not anticipating everyone in being revived for this lockdown, nor indeed later in the year. But one of the reasons that may be less necessary is due to the previous work which took place, and there are many fewer people on the street, some of whom have had some very positive outcomes of not only being moved off the street but helped into other support services and longer term accommodation, some clearly still in short term accommodation. But those who remain on the street are now mostly known to our outreach service, St Mungo's, and they are being offered accommodation. And the severe weather emergency protocol won't now be using the same facilities as they have done before due to social distancing. So that's probably more likely to take hotel accommodation should that be necessary. But I say the cohort is significantly smaller than it was because of the work which went on earlier in the year. Which brings me, Chairman, if I may, to Councillor Haynes' updates on compliance and enforcement. And I think she and I were probably inadvertently playing fastest fingers first in response to Councillor Cox's question on COVID marshals, and I'm sure she'll get onto that. Thank you.
Councillor Haynes, are you there with us?
I am, Chair.
Yes.
Are you ready for me to proceed?
We certainly are. Thank you very much.
Thank you very much, Chair, and thank you to Councillor Nicola Green for that introduction. So I will be talking to board members, and good evening to the board members, on compliance and enforcement. So work in this area has been ongoing since the first lockdown was eased, and the numerous strands to the output from regulatory services and community safety delivering our COVID response to the pandemic. So since March, there has been multiple changes in legislation, as we know, and the freedoms of our community and our businesses have basically been under strain because of this. So the approach to compliance and enforcement is very much a multi-agency effort. We're working to the following principles: ensuring a balanced approach is taken to providing support and advice in the first instance, seeking compliance by educating, explaining and working with local residents and businesses, but ultimately, if it was required, taking robust enforcement action. So it's multi-agency. So by that, we actually work with our police colleagues as well. And then in places like Bournemouth Town Centre, we work at, well, not just Bournemouth Town Centre, we work with the BIDs, and we also work with the rangers that are present in Bournemouth Town Centre. So our environmental health officers have been visiting businesses to check that they are following the COVID secure regulations, along with offering advice and guidance on the rules. Now, there were concerns, I think, because there was the 10 p.m. curfew, as some people were calling it, or closing of the hospitality trade bars and pubs. And so we made sure that we had not just the CSAS, but we had our environmental health officers on standby, because we were fearing the worst, that everyone will decant at 10 p.m. and then they will linger in the streets, and then that would then break the rule of 6. But fortunately, that didn't actually play out, but we were actually ready in the event that it did. So as part of the strategy to help with compliance of COVID regulations, we were awarded some funding to provide COVID marshals, which then comes on neatly to the point that Councillor Cox had actually raised in terms of, well, what do they do and what have they done so far? So the Marshall Scheme is part of a wider programme of activities to promote compliance with COVID-19 regulations, and the Marshals will work with our council officers, such as the environmental health, our business information officers. The business information officers actually go around, talk to and engage to our local businesses to really help them clarify, because I think some of the guidelines and regulations can be a little bit confusing in terms of what is essential, what is not essential, and the list goes on. So that's the role of the business information officers. So the COVID marshals also then work with our community safety patrols, which will be our CSAS officers, and with our shop watch and town watch schemes. So we have recruited 7 people, 6 marshals and 1 supervisor, so 7 in total, and they work 7 days per week in 5-hour shifts at various times of the day, focusing on areas where we are seeing transmissions, higher transmissions, but also patrolling our town centres and other shopping areas. So they actually work BCP wide. So what is their role? Their role is to help promote social distancing and encourage public compliance with COVID-19 public health measures, educate and explain COVID-19 secure guidelines in the public realm and for business premises, identify and support businesses and premises not following guidelines, and escalating as appropriate. So they will do things like they will patrol around and they will help with queue management. So if you have obviously not currently because we are in lockdown, but if you have queues trying to go into, say, a pub or a bar and social distancing isn't being observed, then they would actually advise that people actually observe social distancing. But having said that, I live not far from a local bakery that has a queue, and sometimes they are social distancing, sometimes they're not. So that would be another example of when, if a COVID marshal was around, they would actually approach the people on the queue and they would advise them to say, please be mindful that we are still in the middle of a pandemic, and to observe social distancing, and to make sure that people wear masks when they actually go into premises. So in the first 5 days, they started on the 31st of October, Saturday 31st. And on the first day that they started, we decided that because it was Halloween that weekend, and there was possibility of Halloween parties taking place in the Bournemouth area, particularly with the nighttime economy. So that was where they were focusing their attention there. So in the first 5 days that they've been operating, they have reported 15 businesses not following the correct regulations, dealt with 12 incidents where large groups of people needed to be dispersed. And to date, the marshals have been active in both Bournemouth, Poole and Christchurch Town Centre, along with Boscombe and Ashley Road in Poole. So then on the 5th of November, as we all know, we went into the second lockdown and enforcement activities were stepped up. So just before I go further, I just wanted to clarify, because people talk about guidelines, they talk about regulations. So on the 5th of November, when we went into the second lockdown, a regulation was actually passed. So this is actually legal, is actually a law, and it was the Health Protection Coronavirus Restriction England number 4, Regulation 2020, and that's law. And so as a local authority, we were duty bound to actually enforce, because that was our role in this, to actually enforce the regulations as laid down in that document. So we went into lockdown, and as a result of that, regulatory services received a significant number of calls of large-scale non-compliance with this new legislation. So to address the issue, an operational decision was taken to divert our environmental health officers along with our trading standards officers to deal with the volume of calls received, because obviously we were in lockdown. We wanted to make sure that people were COVID secure, and that everything that we could do to help facilitate social distancing and to slow down the transmission of the virus, we wanted to make sure that we were able to do that. So the weekend of the 6th to the 8th of November, we had a team of 12 officers working over the weekend to actually deal with the volume of calls that we had received. And they had actually visited approximately 100 business premises in that timescale, giving them advice, giving them guidelines. And I'm pleased to report that actually in the main, it was because there was confusion, and also that members of the public who were phoning in to report the non-compliance didn't quite get that actually there were rules and there were guidelines. So the businesses were very accommodating. They listened, they took the guidance, they took the advice, and they made whatever changes they needed to in order to be able to continue to operate. So some of the visits that the officers had to conduct were done in pairs, because there may be a risk that the business owners or the places that they had to go to, that they may provide a challenge, and they didn't want things to get ugly, so therefore they worked in pairs. And I think in some instances they also went out with our police colleagues where there was significant resistance, and we didn't do anything different, but the presence of someone in a uniform actually made a difference. So in conducting targeted visits, officers were mindful of the confusion, again, that was caused by the associated guidance and the reference to essential and what is non-essential business terminology that is not defined in the regulation. Now, Part 3 of the schedule to the regulation defines businesses permitted to remain open, but business proprietors tend to read the guidance only, hence that further confusion. And then obviously for businesses that were classified as non-essential, they could continue to operate, but on a click and collect basis. So people can pre-order, go to the shop and collect, but they don't actually set foot in the business premises. So as I said, the majority of the businesses are found to be compliant with the closure regulations. And then in terms of some of the hospitality businesses, most had removed tables and chairs from outside their premises or made them inaccessible to the public. It is considered that having a visible presence had been beneficial and will ultimately result in greater compliance, and members of the public who spoke to regulatory services were happy to see that they had been actually out and about, there was a presence, and they were checking on businesses. So the upshot was that to date, since the second lockdown, 3 fixed penalty notices of £1,000 have actually been issued, 2 to Happy Buddha, the one in Poole and the one in Bournemouth, of which there has been quite a bit of media coverage. And the third one was to Le Munch, I want to say, but I think it's actually Le Munch in Christchurch. So, Chair, in summary, with the compliance and enforcement, we'd worked very hard. Officers had worked very hard. They'd really stepped up. So I wish to extend my thanks to them. But the ultimate reason that we're doing all of this and our priorities to make sure that we keep our community safe, we engage with our businesses to provide the advice on how they can continue to operate, because times are tough for everybody. But doing what we've done, we've been fair, we've been consistent in the way we've actually applied and implemented the regulation, which, as I said before, we are duty bound to do. And as I say again, ultimately, it is to keep our community safe. So I'll stop there, Chair. Happy to take any questions. Thank you.
Thank you, Councillor Haynes. Councillor Cox, can I come back to you first of all? Does that answer your question?
It answers some of it, certainly. I'm still unclear as to what assessment we're going to have at the end of all this, as to what the value for money that is being spent on all these officers. I have to say, personally, I'm very sceptical about it, and whilst obviously we have to make sure that regulations are being followed, particularly in terms of social distancing, you know, this has to be done in a light touch way, in my opinion, if we're to carry the public with us. Thank you.
Did you want to come back on that, Councillor Haynes?
Yes, please, Chair, if I may. Yes, so I thank Councillor Cox for those further comments. So to be clear, the COVID marshals were funded from a grant that we received from central government. Not all the grant was actually spent on COVID marshals. What we also spent part of that grant on what I call business information officers, where they were actually going around and actually engaging with the businesses, so that they could get all the help and advice they needed in terms of what they had to do in order to be able to continue to operate COVID secure. So in terms of, I think there was another point you raised, Councillor Cox, earlier, where you said who do they report to. So ultimately they report to Andrew Williams, who heads up the antisocial and community safety side under the service directorate. So that's who ultimately they would report to. But in terms of assessing value for money, it's still early days. I take your point on board. It's a good point, but I think that what they are doing is in fact a very light touch approach, as you have suggested, because COVID marshals do not have enforcement powers. All they have is they have the ability to be able to go there to engage, educate, and provide advice to people on what they need to be doing. Thank you, Chair.
Thank you very much, Councillor Haynes. Councillor Tony O'Neill.
Thank you, Chair. I'm concerned about the nighttime economy. It's quite an important contributor locally. What help or assistance or support is being made available to them specifically?
Thank you, Chair. I'll answer that. I didn't actually cover that in my compliance and enforcement because it didn't exactly come under there. But what has actually been made available by the government is some funding, and we have stood up today. Let me see if I can get the acronym LRSG, which is the Local Restriction Support Grant for businesses that have had to either close, or businesses that basically they had to close because they couldn't continue to operate, or businesses further down the supply chain. So say it's a restaurant, and then businesses that supply the restaurant, because the restaurant's closed, they themselves were actually affected. So I think a press release actually went out today. It's all based on the rateable value of the business. So a press release has gone out to encourage businesses to actually apply for the relief. And I'm glad to say Councillor O'Neill has referred to the nighttime economy. Previously, the nighttime economy, so people like nightclubs, for example, they unfortunately missed out and they were left out. But this time round, they are actually included within the scheme. So they will actually receive some help this time round. And I know that also, I know Councillor Broadhead's not on the call, but I know Councillor Broadhead has been doing some extensive engagement with the hospitality sector and all those businesses there as well.
Are you content, Councillor O'Neill?
No, thank you very much. I found that very reassuring, particularly reference to the nighttime economy, which is important. Thank you.
I know there's Councillor Mellor, it's the financial thing, so I noticed put his hand up. Was there any, before we go to Councillor Mellor, Councillor Green, is there anything you wanted to add to what's been said?
Not at this stage, Chairman, thank you.
Okay, Councillor Mellor.
Thank you very much, Chair. Yes, just on top of that to say, May's absolutely right about the LRSG. You know, and that's effectively a first tranche which is going out this week. We've also been given £7.9 million, which will end up would be a discretionary fund, and the Councillor Broadhead has worked extensively with the business community to understand what you know, who should be in that discretionary fund. So overall, will be about £16 million going to businesses, and we will be announcing the discretionary fund details this week, if that's helpful. Thank you.
Thank you, Councillor Mellor. I think we're probably going to be moving on to the next part of the presentation from Councillor Green, which I think is to do with community resilience. Am I right, Councillor Green?
If you're ready for me, Chairman, yes.
Yes, please, go ahead.
Well, thank you for allowing me this window, because frankly, I think with all the work that's been going on, I would very cheerfully have spoken to you for the entire meeting about the work that's going on under the Together We Can programme, which was the mechanism set up early this year to match otherwise unmet need within our communities, and particularly amongst the most vulnerable members of our communities, and has since grown wings, I think it's fair to say. The activity has changed as it's needed to, as the cohort of people needing support have also changed, but its central mission, and I don't use that word casually, it is a mission really, to be serving the needs of people who would otherwise be struggling, remains. Currently, there are three main lines of business for that group, that piece of work, and they are to members may be aware that in almost every mailing I've sent out on this programme, I've given you the number and asked people to call in. It is really important that it is an accessible helpline for those who are unable, particularly to access stuff digitally, there is a huge amount of digital communication, much of it very useful, which isn't always the case, but around the support which is available for members of the public who need it. But it is also equally clear, particularly with the cohort of our most vulnerable people, that they need somebody at the end of the phone. So there are, over the last week, we've at peak demand been receiving about 300 calls a day, which is a very large number, but I'm sure Councillor Slade will remember that peaked at about 800 per day in March and April. And I do think it's worth making the point that we seem to see that the community resilience has built over the past 6 months. We absolutely still have that focus on supporting the most vulnerable members of our community, but we should recognise and welcome the support which has grown around some of those individuals, but also collectively as a body. So those calls come in, some of them are very simple triage, and some might be slightly more in the line of requests for support or signposting. The second business which the helpline is, the Together We Can programme is dealing with, is in support of the National Test and Trace programme. We're doing very well keeping up with making welfare calls to people who've already tested positive, but there is still some work to be done on making sure we've got the full amount of support which will allow the self-isolating contacts of those people to be contacted. Apologies for peering, but there have been over 2,500 calls to people who are isolating, and we're catching up, but still a little way behind on those. And those are really, many of those calls are really brief, but they are very well received. They're just checking out that people are okay, and people generally are very appreciative of it. And the third focus, which is about 2/3 complete, is the calls which are being made to the clinically extremely vulnerable cohort, which is different from the shielding cohort. Well, it's a subset, probably is a better way of putting it, of the cohort that were asked to shield in the first lockdown. This is a government initiative, and it's people who are, says it on the tin, clinically extremely vulnerable, and probably should be keeping themselves entirely in isolation. There has been a very low level of need amongst those. To be clear, when I said we're two-thirds of the way through, what I should have said is that actually we have something like, and somebody will catch me out on this, something like 80% of that cohort we have email addresses for, and they've all been emailed and or written to. And we've had responses from very many of them essentially saying, actually, I'm fine, thank you, I now know what to do. But the calls are, the centre is there for people who are struggling, who don't have family and friends, who are able to help them out. But very little in terms of need coming through, in terms of people actually needing food support and so on. But people are all aware of the offer which is there to them. And I just wanted, if I could, to go back to Councillor Earle's question, which I think might be the theme of the night, and it's about how are we providing support and mental health and emotional support to some people who are having to self-isolate. So all those people on the clinically extremely vulnerable are being contacted and should be aware of the offers that are out there. And I think the work that has gone on building the resilience, and we're seeing that in terms of the responses to phone calls, is helping. And places like Pramacare, but they are not unique, offer a befriending service. There have been virtual coffee mornings and so on put forward by a lot of groups. So that is, it's not the full answer to your question, Councillor Earle, and we can't give absolute assurance because we would always want to do more. But there is a large amount of support out there. moving forward, the priorities of the thank you. I'm sure I did think you were listening. Moving forward, and it's been an ongoing thing, is making sure one of the priorities is the Access to Food programme. Again, work was set up, a partnership, of course. This is not just about what the council does. There are many community and voluntary sectors who are part of this. But we are making sure that the publicity, the communications is there and is accessible and relevant to the people who need to hear it. And something which has had clearly a lot of publicity, quite understandably and correctly, and there may well be questions, is on moving forward to the Christmas arrangements. It's no surprise that Christmas will happen round about towards the end of December, and therefore those services must be stood up. There is a huge amount of goodwill. We are quite rightly focusing on the challenges for our residents over this period and making sure that we meet their need, but we must be conscious of the massive generosity and outpouring of goodwill, which is also taking place alongside. People are incredibly generous with their time and with their offers of support, and that goes for our businesses who themselves are struggling, as well as for individuals and groups. So I don't have the details for members tonight, but I will be happy to report back. But we are, of course, looking forward to looking ahead to how best to serve our children who are eligible for free school meals or otherwise vulnerable over Christmas and indeed into the new year. And the thing, as well as Christmas, that particularly preys on my mind is the February half term, which when the weather, if we're struggling in November, it's going to be dark and grey. For much of February, it will be after Christmas. It's not a good time for people who are struggling, and therefore we need to plan for those two things. So work is ongoing. Very happy to answer questions on it, Chairman. So I will constrain myself to a little time, but I would just, if I may, beg your indulgence while I thank the contribution which many councillors have themselves made. One was mentioned in dispatches only this week, who, having just a couple of weeks leave from an otherwise very demanding job, gave 2 days to make sure that she was in touch with some vulnerable residents, and to everybody who's used their social media channels and their other good offices to make sure that our residents are aware of the offers that are out there. I'd just like to give them my sincere thanks. Thank you, Chairman.
You're on mute, Chair.
Thank you. Thank you, Councillor Green. Yeah, do we have any questions on that section of the presentation from members? I'm not seeing any, so if your voice is up to it, Councillor Green, do you want to carry on?
I can, Chairman. I've got a little more by way of an update about our leisure facilities, but I did refer to it earlier. It's just something that's come up. Apologies, I'm looking for the right paper. This is why I should not. This is why I need notebooks. But it's just around the facilities which are open. Chairman, I'm sorry, I can't access it. It's around some specifics relating to Hengistbury Head and Stanpit and so on. And if you, it would be much better if I could just ping through an email on that update. It's very straightforward. And as I say, most of our parks, beaches and gardens have remained open.
Okay. Thank you, Councillor Green. I know that we've got economic recovery plans. Is that something we should invite Flamella to have a few words on?
Perhaps I could just give a bit of an introduction to that, Chairman, and I've got proper paper notes that I can refer to on this one, and then if Councillor Mellor could follow on, and it won't take long, I hope. The council's response has to business to encourage our businesses to be moving on comes under the R-cubed label, and the three elements of that are for the retail, the hospitality and the leisure sector, which Councillor Haynes has referred to, also for businesses outside of that sector, and including support businesses, and also on the welfare angle of looking at where sadly people have had to lose jobs, and that is taking some account, Councillor Earl, of mental health aspects and the welfare impact on employees. We can't lose sight of the need to of our business sector, their own needs, but also the impact that they have on the employment and on our economy more generally. We have had regular comms with them almost daily. We've sent out updates to the thousands of businesses on the data on a database, and Councillor Mellor may well refer to some of these grants, what's available, what the parameters are, and when the deadlines are. In what looked like a bad bit of timing, we launched the Rediscover Safely programme, but actually it was a great challenge to us, coming as it did just before lockdown, because it enabled us to focus our resources on Rediscover Online safely, and we were able to work very closely with the bids and our chambers still to be pushing forward that message of there are local businesses who need your custom. I'll say no more at this stage, Chairman.
Thank you, Councillor Green. Councillor Mellor, did you want to add to that?
Not a lot to add to that, Chair. What a full summary from Councillor Green. So thank you very much, Nicola, and thank you for your leadership through this whole process. I just touch briefly, Chairman. You know, I think it's a mixture of national and local, isn't it? So on a national perspective, you know, economic wise, we're really pleased to see the furlough scheme extended through the rest of the winter until March. Should allow some of businesses to be in a position to effectively mothball where they can and then come out of this stronger, as we're all hoping 2021 will be a more positive year. We've touched on it briefly, but I just, you know, the extent of the engagement we've been doing with the local business community was a real priority of ours. You know, so extensive work with Dorset Chamber, Dorset Growth Hub, you know, our economic development officers. So we're trying to really build a real picture of what our local position is and what our local need is. We've touched on the grants, the LRSG and the discretionary grant. Really important in the fact that what we're trying to do with those is to make sure businesses aren't falling through the gap. So effectively, you know, we have the experience of, you know, the luxury of experience in terms of this is the second time we've had to stand up a discretionary scheme. So, you know, we're able to, you know, realise what actually was an issue before. So that's a benefit of ours. Also worth noting, Chair, that quite a few businesses are still open. You know, significant money in the last scheme went to dentists, as an example. Dentists are open, so there should be less calls on this discretionary scheme than some. I think it's worth noting as well what we've said, and this is coming out this week. Effectively, the discretionary grant guidelines will come out this week. But is you can actually get you can apply for both. So just because you've got a business premises, which means you are acceptable for the first scheme, if you've had to close, you also have other running costs of your business. So it's reasonable with strict criteria in certain circumstances to apply for both, and that's important. I think for us, really nailing down on the local is making sure we don't lose our destination economy. That's, you know, that's an absolute priority. So what do I mean? Hospitality. We've heard about nighttime economy. You know, all of that of the event sector. So there are some sectors that haven't, you know, had a lot of support before, and we're making sure that they will be able to have some support in this next phase. Chair, look, you've already had a long day. I won't go on for too much longer. I'm very happy to take any questions.
Yeah, thank you, Councillor Mellor. But I think Councillor Slade had a question earlier on that may be in your area. Are you still with us, Councillor Slade?
Oh, of course I'm still with you.
Yes.
I did hear somebody else seem to be like, you know, doing some food going on in the background, but it wasn't me. I'm really pleased to hear that we're going to have the discretionary scheme up and publicised by the end of the week. And if I heard you right, it's 7.9 million that's coming from the discretionary scheme. You'll know there were pretty tight restrictions even within the discretionary scheme about what businesses were allowed to be supported under the previous scheme. Does this discretionary scheme give genuine discretion, and will it allow businesses who don't have rateable premises to claim, and will it do anything for the excluded, so the freelancers and self-employed people who don't have any recourse to the self-employed scheme because they don't have the time self-employed, or are they still excluded? Thanks.
Yeah, thank you very much, Vicky. So yeah, and effectively, and I share your frustration historically in terms of discretionary, but not that discretionary. You know, so hands were tied. My understanding, we've been in detailed discussions last week with our officers in terms of setting the direction on this, is there is a significant amount more discretion in this scheme than there was historically. So that's really positive. We're able to do things like, you know, slice pots of it away to invest in certain size of businesses or certain types of businesses. So I'm comfortable that we've got what we need to make this a genuine discretionary scheme, which is useful. I believe you a question about the rate. Is it available to people other than just with rateable values? Yes, it is. And I think it's worth and a lot of this is born out of experience. It's a fact that, you know, government are learning about this, our officers are learning about this, you know, and our communities are learning what went forward. So, you know, this isn't, you know, credit to us. This is just the scheme changing and evolving. I think it's worth noting, I did say it before, but you will be able to, if you've got a ratables pot, you will be able to apply to the second pot, you know, and vice versa. So that's useful. And yes, Vicky, it will include freelancers. What we're trying to do is make sure that anybody who fell through the cracks in the first time, you know, it is prioritised in this scheme, and it will be out this week. So I'm really glad that not because of us, you know, as an administration, but just as a, you know, general movement on it, we're able to say yes to all three of the things you raised.
Thank you. Okay, Councillor Slade, are you okay? Looks like it.
Yes, I'm pleased with that, and I'm looking forward to sharing it with the public, because they'll be very grateful. Thank you.
Thank you. Councillor Kelsey.
Yeah, thank you, Chairman. Bit of a question for both Nicola and for Drew. We were well up doing our deliveries through the half-term holidays for those children that needed it and everything with this. Are we fully prepared and ready for the Christmas period on this one? And are we going to give plenty of notification about what's going on? I think that's probably in your court, Nicola.
Nicola, do you want to go answer that?
Yes, very much, Chairman, and thank you, Councillor Kelsey, and again to everybody who helped during half term. We don't have the answer yet, but I think we know what the questions are. So we've had a couple of meetings today where we are looking particularly to make sure, firstly, that nobody falls through the gaps, but also we provide a coherent offer, because we know that some of our families where a child is eligible for free school meals are the same families who are accessing other benefits. And it is pointless, it is a waste of resources, but it is so confusing for those families if we send them to 2 or 3 different places, or they're accessing help from 2 or 3 different places. We cannot absolutely guarantee that this is going to be streamlined, but by identifying what those problems are, we are trying to get our finest minds working on it. And on your point about the time frame, you're absolutely right. We know we need to give notice. We know our schools are going to be absolutely crucial in this, and the school meal providers as well, who we think are going to be one of our delivery arms. Clearly we need to give them notice. There is also something else which I just want to raise for members, that our current numbers for children eligible for free school meals is about 9,000. We are very much aware of the impact, although yet unquantified, that the past 6 months has had on a lot of families. There is a census which takes place in schools in October, and that we fully expect to give us some significantly higher numbers of families who are not only eligible for but are claiming free school meals. We also are keen to make sure that while free school meals is a fantastic and well known well-validated indicator, it's not the only indicator of need. And therefore, and indeed it doesn't always demonstrate a particular type of need. So what we're trying to do is make sure that we're using the right information that we and the partnership hold to make sure that we target the right families. We also know that however much positive communication we do in advance, there are some people who won't be able to recognise that they have that need necessarily in advance. And therefore, we're conscious that there needs to be a mechanism which allows those families to get the support that they will need later on in the day. So, as I say, we don't have all the answers, but those are the questions we're asking. If members have got either specific ones or general ones that they'd like to feed into me outside of this meeting, as I say, where we're trying to get to is to have a proposal probably in a week or 10 days time, which we can then take forward to the partnership and test it, stretch it, and see how it works, and then to be using our wider communications to move on with it.
Thank you, Nicola. Are you content, Councillor Kelsey?
Yeah, sorry, Chairman. May I just ask one more question, please?
Yeah, sure. Go ahead.
Thank you. Nicola, you talked about communications there, and obviously communications is the most vital thing. And are you happy and content that as an authority we are getting as much out to as many different people in as many different ways as possible? I mean, as we know, not everyone is on the internet, not everyone goes to a library, and very few people read the local comic, I mean the Daily Echo. So just wondering to make sure that we actually are getting as much out as we can.
Well, I'm a happy and content sort of a person, but this is a different challenge, I think, and we could always do more. And we always need to ask our wider partnership to make sure that everybody's exploiting every contact that there is. And as I said earlier, we have noticed that people are talking to people a bit more. We're using some other channels, but people are having conversations. And this is a personal observation, but people seem to be better at talking about mental health and also about need than they have been in the past. We have a better vocabulary and we are more confident about using it, but that doesn't always extend as far as we would like it to. Clearly, we are not using one of our best resources at the moment, and that's our libraries. The libraries are doing a terrific job and they are still enabling people to collect books through click and collect and so on. But we know that walk-in opportunity, getting to people through wriggle and rhyme who may well have older children in schools, we don't have access to that. So my plea to everybody is always to use their best efforts to, whether it's through a faith group, your social media pages, just chatting to anybody, your surgeries, please never forget the role that we all have in extending those communications out there, because you're quite right, we can always do more.
Yeah.
Thank you, Nicola. Thank you, Chairman.
Yeah, thank you. Councillor Rigby.
Yeah, thanks, Chair. I had two questions and they've both pretty much been answered actually. They were about the school meals and the discretionary grants. Just to go a little bit further on the discretionary grants, I know Councillor Melly spoke about the support for the nighttime economy, which is obviously a massively important part of Bournemouth's economy. So it's good to hear that the support will be there for that. But we have got a number of local sort of support businesses who work with them, local breweries, local food manufacturers, things like this, cleaners, laundry, who tie into the nighttime economy in hotels. Is there going to be that same sort of reassurance for those as well, who have been affected but on the front line, so to speak?
If I may, Chair?
Yeah, please. Please.
Yeah, it's a really good question, and effectively, I tried to answer it earlier when I said effectively, the first sweep of this is to really understand who fell through the cracks, last time, and there were a lot of support businesses that did. So simple answer, Chris, is yes. If there's anything specifically that any of us are hearing about, we've had significant engagement, both people coming to us and us going to other people. So we think we're on top of it. But if there's anything anybody's particularly worried about, please email directly to me or call me. and I'll make sure before the scheme gets launched this week, I can just cross-reference it. So hopefully that gives you some assurance.
Thank you, Councillor Miller. Councillor Fear. Oh, sorry. Can I just come back to you, Councillor Rigby? Was there anything else you wanted to ask?
No, that's fine. Thank you very much, Chair.
Thank you. Councillor Fear.
Thank you, Chair. My question was just kind of a follow-up from what Councillor Kelsey was saying earlier. It's good that there seems to be kind of movement going forward for coming up to Christmas, but obviously in the new year where bills sometimes seem to be stretched, it was just to get reassurance for the public on that what you're taking forward, Councillor Green, in the next couple of weeks, that will the new year of 21 will be included in that for these first kind of critical months from January through to March, where obviously the weather's still going to be quite bad, the vaccines still won't be here on our shores, so to speak. So it was just really kind of getting that reassurance that yourself and the Cabinet and the wider Council are doing everything possible to ensure everything's being done. Thank you.
Councillor Green.
Thank you, Chairman, and thank you, Councillor Fear, for that question. I mean, yes, you're absolutely right. In terms of the school meals programme, I need to be quite clear that we are looking at what is sometimes referred to as holiday hunger. The programme that we are trying to set up will cover the school holidays. And that includes working towards, whether or not we have the solution at the moment, but working towards half term as well. And that is what we've received some government funding for. We're still, as far as we are aware, that's to be spent by the end of the financial year, but it doesn't necessarily say exactly what it's for, because there are a couple of other things that might be. We are allowed to use it to target families rather than just the child, but it needs to be through, going back to a much earlier conversation in the day, through the lens of the children in the family. In terms of other issues and challenges for families, I would refer to the Let's Talk Money programme, which is being run by the Citizens Advice Bureau. And that is, again, it's one of those things that we're getting better to talk about, talking about. But if you have any resident or any opportunity to point people in that direction, that is exactly what that is aimed at. And please do it now, rather than in the third week of January when we're, all struggling. Because one of the things that we know it is hardest for people to do is to address money issues before they happen. And even knowing that something's coming down the road, you are in a better position to come out of it if you can address it in advance. It doesn't solve all the problems, but it is so much better than waiting for it to happen.
Thank you, Nicola. Councillor Fear, are you okay?
Yeah, I just want to say thank you to Councillor Green on that. That was really great signposting as well for some of my residents who have come with some concerns on that issue. So thank you very much.
Thank you. Councillor Earl.
Thank you, Chair. I have a question for Councillor Green. My ears sort of pricked up at the word library. Really, it's about other services operating within libraries. So obviously in certain areas we have citizens advice, support groups, and we also have in my area community fridges. And I've been waiting on legislation. Well, I know what the legislation is. I can read it. It's online. But I've been waiting for the go-ahead from the library services on whether we can operate. And it's been a couple of weeks now. And I just wanted to ask, obviously I can adapt my service, but I know some others can't. So I wanted to find out what the situation was with services, particularly the vital ones, operating within libraries during this lockdown.
Is that something you can answer, Councillor Green?
It's a bit specific to answer. I can give a more general answer, and very happy to discuss with Councillor Earl the more specific ones. I'm sorry, I'm not quite clear though, because the community fridge is operating, isn't it?
Not inside the library, no.
So it's the location issue.
I'm on the draft side.
Okay. In that case, I'd be very happy to take that to the, sorry, I wasn't sure whether it was that or the CAB that you were referring to, because one can work online and one can't.
Just more of a general point. Obviously, libraries play a bigger role in our communities than just, you know, getting out books and that kind of thing. Obviously, we've got the computer services, we've got services running from inside, which are basically contracted out by the council. So I just wanted to find out, how are our services, which are really important, coping, and whether they are operating within the libraries as usual, or if they've gone to online services, that kind of thing.
I think it will depend upon the service. Clearly, there is a specific issue around the community fridge, and I'd be very happy to discuss that with you in the context of the food resilience group, because I think that's probably the right place to do it. Some services are able to operate online, and some clearly aren't, and I think it is all our best wish that the libraries are one of the first things we get up and running again. They worked incredibly well in that period between the lockdowns, and made some great steps so that they could carry on delivering those really, really valued services. But I'd be very happy as well. And I know Mehdi Bernard would be delighted to perhaps to come back to this panel if you wish, Chairman, if you wanted to go into that in terms of a bit of evaluation or just to have a general discussion. But in terms of the specific, then Councillor, I'm very happy to take that out of the meeting, and we can discuss it afterwards.
Thank you, Councillor Green. I'd really appreciate that.
Yeah, thank you. Councillor Haynes.
Yes, thank you, Chair. Just on the point that Councillor Earl raised, I'll take this out at the meeting with Councillor Green, because I'm just thinking in terms of compliance and enforcement, there is the option to do a click and collect. I know it's probably not what Councillor Earl had in mind, but I'll speak to our environmental health to see if there might be some way of working this through. Thank you.
Thank you, Councillor Haynes. Councillor Green, are you just about finished with your presentation now?
I can stop now, or I could just give a very quick word about communications. Actually, I think we've probably covered it in terms of we have been putting out through the council, through members' own social media and stuff, as much information as has seemed relevant and timely. And if members would find anything else useful, then they're very welcome to get in touch with me. And we'll feed it through. But just lastly, would you like a quick word on the planning ahead for the release of lockdown?
If that means we can have a party, please go ahead.
Well, that would be nice. Actually, this quite neatly brings us back to where we started, and I think Sam mentioned it, that the government is clear that local authorities will come out in tiers into the tiering system. What they're not clear about is where they will find the appropriate boundary for that tier. There's a debate clearly, and that's going to need to take place over the next 10 days or so. If we think we're kind of 2 weeks ahead of the 2nd of December, and clearly one would expect there to be some notice of which tier and therefore what restrictions we would come out in. And we have been staying in touch with our MPs in terms of this. And also we'll need to consider whether other mitigation needs to be considered within those rather crude but necessary boundaries of tiers 1, 2 and 3 are. And again, just looking ahead, I think Sam mentioned the vaccination programme, which is a clear lead for the NHS, but the council stands ready to help in pretty much whatever form the NHS asks for, and we don't know what that ask might look like, but we will integrate in the very best way we can. And one way that might be is through our volunteer team, who, if we've got a large number of people going through doctor's surgery or wherever, they may need some assistance, and our Together We Can volunteers are a marvellous bunch, and if we need to deploy them in a particular direction, that's something that would be considered. The food programme is clearly going on. We have questions about how we will continue to support people who are clinically extremely vulnerable once this lockdown finishes and they no longer have their food parcels. But if I can just reiterate, the numbers of people who are saying that they would like that support are very, very small. The Community Safety Partnership will continue, obviously, its work on domestic violence services, and going back to Councillor Cox's question, we are ready, as Councillor Haynes has set out, to deploy as best we can when we know what the likely, when the date is, what the reduction in restrictions is likely to be. And we have obviously our CSAS officers, and we'll be working with the bids in the town centre as well as the nighttime economy. I think I'll stop there.
Thank you, Councillor Green. I admire your fortitude. You've done a lot of talking this evening, but there are no more hands being displayed at the moment. So I think we're going to do this presentation and debate to an end now. But in doing so, can I thank Councillor Green for what's been an extremely comprehensive overview, along with Councillor Haynes and Sam Crowe from Public Health. So I think it's been a really interesting and very comprehensive brief. I think, Nicholas, you've just put your hand up again. Oh no, you have finished. Oh, okay. Yeah, so there'll be no more questions on that. I will just say that, someone said it feels different. Yes, it does feel different, this lockdown, but it still feels horrible. And it's interesting to see how many areas, COVID, it touches everybody's life. And for the work that the council's doing, it's reaching into every nook and cranny of it too. And it's totally absorbing us in so many ways. And after our debate this afternoon about our forward plan and our priorities, I think this brings hopefully members focused back to what's really the critical areas for us to think about at the moment. Before I just close that, I've got Chief Executive would like, I think, to say a few words. Chief Exec.
Thank you, Chairman. If you don't mind, I really just wanted to re-emphasise that point that you've made about the scale of the impact that COVID has had on society, on the economy and on the council. I don't think you can overstate the impact that it has had. You think about the scale of the change we made, and everybody says local government is slow to change, it's hard to turn around. And I was just referring back to my notes, and literally 9 months ago, the 13th of February, so 9 months ago last Friday, I came back from a meeting of South West Chief Execs, and my note read about just pandemic preparedness frameworks due to be sent out. We need to get ready. And I sent those notes on to Corporate Management Board with a note saying the most notable item of discussion was the section on COVID-19, which is worth everyone reading, and we can discuss at our next meeting. In that, we talked about the potential for wider economic impacts, panic buying. We talked about potential change for the global economy. Nobody, I don't think anybody, thought it was going to be of the scale that we've seen. Interestingly, my notes also said there could be a double peak with a reduction in summer with the seasonal effect, followed by a new peak in autumn or early winter. Well, that feels just about right. But I just want to reflect, we've all learnt a new language: lockdown, self-isolating, shielding, furloughing, the R number. We've all learnt this new language, we've adapted to it, and I just want to pay tribute really to all of the staff of the council and to the councillors, and to the volunteers. We had over 2,000 volunteers coming to work with us. We've sorted out PPE, which was a massive issue in March and April, we remember. We set up mortuary provision for over 1,000 body spaces. We didn't need them, fortunately, but we did that. We stood up food parcels for about 17,000 people, so it was huge initiatives. and we set up new safeguarding arrangements, etc. I hope we've communicated what we've done. We certainly try to work with the leading councillors to send out those communications that were started under the Unity Alliance and have continued. So hopefully we're keeping people informed. But I just wanted to reflect on the scale of the change, because it has been huge. I have to say, I think BCP Council, as a new council being stood up out of the three, actually has withstood that test very, very well.
Thank you, Chief Exec. It's interesting you mentioned the new language. We heard a couple of new words, I think, today, which is, I think, good news, really good news, and that is lateral flow tests. Now, that's another expression that we're picking up on, but it's got huge potential to help so many people. So let's hope that comes forward and we can actually get people in our care homes, in touch with their relatives and families, etc. So with that, then I think we'll close this particular item. There are a couple of little items left on the agenda, which I'll quickly go through. We have the forward plan, which is listed. Now, we've talked that to death this afternoon. I don't intend to go into it now. Indeed, we can't, but we will discuss it at our next meeting. And then lastly, we have the meeting dates, which if you haven't got them and need to make a note of them, the next meeting date will be the 7th of December. Next one's the 4th of January, and the 1st of February, 1st of March, 1st of April. So those are our forthcoming meeting dates. And finally, I'd just like to thank all those members of the public that have taken the time to watch this debate. And I hope it will enlighten you to just how much the council is working to serve the residents and help wherever we can. Can I also thank the members for enduring these 3 very long sessions we've had today, and also thank you for the people that have worked so hard to give us presentations that we've received today. So I will now close the meeting. I look forward to seeing you all again shortly. Thank you. Bye.